Hello guys, and welcome back to another video in our medical and dental school interview series. The Medology Lions, we are happy to have you again, and today we're going to tackle the one question that you're all going to be preparing for. Why medicine and why dentistry? Because this question is bound to come up at every single university, right? True, it is. So your concern is, how do you stand out when everyone is preparing for the question, and also they're probably going to say the same points? Well, that's where we come in. We have worked with thousands of students and helped them get over the line and go through this struggle before, because we know what stands out and we know what works. And believe it or not, it's not always the words that you say, it's more importantly how you say them. And today we're going to deconstruct this question and make sure that you're ready to ace it. So let's get into it. The first thing that we need to tell you is that why medicine and dentistry doesn't always get asked as that question in plain. Often it's phrased in a different way, like, how did you know that you're suited to clinical medicine? Or what was that one moment on your work experience that convinced you that medicine is the career for you? Tell me, what is it about dentistry that stands out compared to any other healthcare profession? Those are all examples of why dentistry and medicine, but reworded. And that's because we want you to understand this first principle. This question, in the back end, in terms of how the university see it, isn't called why medicine or why dentistry. It's motivation and insight. So what do each of those terms mean? Motivation is telling them that you've got good, solid reasons for going into the career. And insight is that you've done the right amount of research. So how do we show both of those convincingly? Let's talk about motivation first. So when it comes to motivation, there are wrong things to do and right things to do. Some of the wrong things are giving the wrong reasons for going into the career or not exploring the profession enough. So that might include saying reasons like money as your driving factor or a good work-life balance. Other red flags include getting your knowledge from just reading a book or watching a documentary that romanticizes medicine or dentistry. That's not enough, okay? So what do some good reasons for going into the careers look like? Let's give you some examples. 4 off the top of my head are being a teacher, blending art with science, showing a high level of empathy, and the continuity of care. So let's work backwards. Continuity of care is this idea that you see patients very regularly and support them with their health. And it's the notion that you meet a patient at the start of an issue and carry them all the way through, and you keep monitoring them and giving them little bits of advice to help them. Now, one thing that's important to do with continuity of care is shared decision making, which is involving patients in their treatment plan to come up with a proper plan. And how do you make a good plan as a healthcare clinician? Behavior change. Behavior change is how we can change people's lifestyle habits so that when they're at home, the things they're doing are going to stop them from getting into a position of disease. And there's methods that are researched about how to do behavior change well, like SMART goals, small, measurable, accurate, reliable, reproducible, and timely goals that you can do with patients to get them from one habit to a more effective habit. For example, if a patient is only brushing once a day, how can you get that up to 2 times a day with flossing? Or if a patient is having 20 bags of crisps a day or 20 cigarettes in a week, how can you initiate a change in the most evidence-based way possible? So that's continuity of care. And if you like that idea of going on a journey with the patient, teaching them, giving them your insights, regularly meeting with them and making a true difference, that could be why medicine and dentistry is for you. Another is being an empathetic person. Think about a tooth extraction or a surgical procedure where a patient's conscious. Even something as simple as taking bloods. You are doing something quite gruesome, tearing through his skin, getting blood out, or in the case of an extraction, tearing periodontal ligament, widening a bone socket, drilling bone, cutting gum back, exposing flesh, all of these gruesome things, but you never say it like that. You word and explain procedures in a comfortable way, and you also talk patients through the procedure, telling them everything that you're doing, but altering your communication to make them feel comfortable. And that is an example of adaptive communication. So if you like that idea of empathizing with patients whilst using your hands and your own skills to carry out procedural work that's for their best interest, that might be why dentistry or medicine is for you. You might have loved the way that a doctor or a dentist can comfort a patient, and that might have resonated with you because you've done some care home volunteering and it reminded you of that role, or you've helped patients in a really critical condition and you enjoyed doing that and you can see yourself doing it in a more intimate way as a doctor or dentist. Teaching. How do we explain radiographs to patients? How do we explain test results to patients? How do we explain to patients how to improve a habit? That is a core skill, and you have to constantly adapt the way you explain things. So maybe if you're a teacher, or you worked at a tuition center, or you've worked with children from a wide range of ages, you'll empathize with those core skills that you need to teach patients, and it might be a passion of yours. So there are, take science and creativity. As a dentist, you are constantly in a position where you're taking a broken down tooth and building it back up. But that process involves biomimetics, restoring the tooth in a way that restores function and aesthetic. But also it involves thinking about the material you're going to use. Can I go with gold, amalgam, composite, a ceramic, lithium disilicate, feldspathic? What are the properties of the materials? What are the pros, the cons? And how do you decide what's best for the patient? So you're blending a bit of chemistry with artistry by using your hands to help patients. You're also thinking about bond strength and so much more. So if that side of dentistry appeals to you, then go and explore that. But you need to find that core authentic reason. And what did I do when I was explaining those answers? I was giving a story. I was giving the backstory or a bit more insight. So that brings us on to the next principle. When you answer this question, it's a very valuable thing to show a variety of sources where you've got information and learning from. So work experience is one example. What's another? Wider reading, doing an EPQ, speaking to doctors and dentists, but also university students, medical and dental students, reading reputable articles like the BMJ, the BDJ. And if your pool of insight into medicine and dentistry is from here, it shows that you are well read. Another thing that interviewers love is when you can talk about two things: the challenges in a career, and show that you've got an insight into not just the pros, but also the bad parts of the career, and still you're motivated to go into the career. And also when you have an appreciation of how the team works. What role does the nurse play, the receptionists, the senior registrars, the consultants, the practice manager, the decontamination nurse, all of the members of the dental team. And if you can appreciate them and understand how it's a team job, then that will also make you stand out. That's why referencing things like the MDT is a good idea, and appreciating how you enjoy those kinds of working dynamics. Now, one of the secret sources to answer this question well is reflection. Now, reflection is literally just adding to your answer, and this taught me, and then saying a learning point that you took away. Now, if you're going to tell a story about your work experience, or wider reading, whatever it is, always end by saying what it taught you. And often the core things that it teaches you are the skills of a doctor and the challenges of a doctor, etc. Now, what you can do here is be clever. And another good principle to make your answer stand out is to explain how your own life activities are going to make you suitable for the profession. So let's say you saw a doctor empathize with a patient, and you give us a whole work experience story on that. Your learning point, i.e. reflection, could be, this taught me that doctors have a huge responsibility to listen to patients and pay attention to their problems, and in conversation allow them to open up by asking open-ended questions so you can get to the root of their problems. I really enjoyed that because it reminded me and taught me that I do a very similar thing in my role as a care home volunteer, where often I'm dealing with dementia patients with loneliness, and I have to ask them loads of questions to get them to open up and speak with me. And I love that because I add some light to their day. Pause. What have I just done there? I've connected my work experience to a real life example. And what I'm doing is I'm showing I've got insight, but I've also got competence to do the same things that the doctors and the dentists are doing, and I'm actually interested in it. So that sort of feedback loop is very clever to set up, where you show a skill in medicine and then show how you've got it yourself, because it shows subtle competence. Now, we've gone into all these techniques, but one of the things I want to leave you with is the very important point that all of this goes in the bin, every single piece of advice, if you don't communicate with passion. Honestly, guys, the best applicants aren't always the ones that have the best points. They're the ones that come to life when you ask them, why do you want to be a doctor or dentist? And you need to be one of them. So how do you do that? Genuine, heartfelt communication. You have to treat this question like your life depends on it to some extent, because you get one shot to tell people why you want to be a doctor or dentist, and it's only 5 to 7 minutes in an MMI. So for those few minutes, you need to learn to find that inner source of energy and spring it out and just project your enthusiasm. Because if interviewers see that, they will see that genuine level of heart that you have for the career. You don't want to fake it. You want it to be very natural. So that's why you should record yourself answering this question and see, do you come across as monotone or dull? And what things do you need to change in your expression to boost that level of enthusiasm? It might be communicating with your body, your hands, your eyes, your facial expressions, but that's a very robotic way to think about it. I think genuinely you do just need to feel like the reasons you're giving in your answer genuinely are true to you and they mean a lot to you. And if they do, your communication will naturally come out and show that you're very expressive and passionate. And that's the end goal that you want to get to. Now, thank you for watching. I think we'll leave it there for principles because I don't want to bore you for too long. But if you enjoyed this and you like the way in which we work with applicants to make answers, then join the interview journey program. We will do this same method and design a custom-based answer for every single interview question across every single station, on top of all of this learning that I'm giving you, with a personal mentor. The course is 3 months. You meet up regularly with a team member like me, and we make sure that we train you up to the point where you're almost guaranteed to get an offer. The course has had a 90% success rate over 5 years, and we know that it works. So if you like our style of teaching and you'd like to work with us, sign up to the program and we'd love to have you on board and see you get into medical or dental school. But for now, thanks for watching, and don't forget to like, comment, subscribe and share this video. Peace out.